Hello, everybody. Welcome. I want to introduce Sonia. Sonia is a doula, herbalist, health educator, and midwifery student. She's also a business owner and podcast creator. Sonia is extremely passionate about supporting women and families through every phase of birth. And with that, I'm going to pass it off to you. Thanks for being here.
Thank you so much for having me. So I'm very excited to be able to have this particular conversation today because I feel like there is no other time than now to have such an impactful conversation, and it is very layered. And what I would like to do today is essentially just kind of like share my heart, one, for this field, but then two, also give you background and then some resources at the end to continue your study. And so, one of the things that happens when we talk about racism in gynecology as well as obstetrics, there are so many layers that we probably will not be able to cover all of them on our 25-30 minute chat today. However, I want to give you some pinpoints. So, like I said, you can then proceed to do research later. So, my goal for today is to just kind of give you an introduction session. And then we'll talk about the brief history of racism. We're going to talk about the gynecological experiments that took place on slaves that have gotten us to a place now in our medical history today. And then I want us to have some conversation about what it looks like to bridge the gap, and then open it up possibly for questions for you all to be able to ask me at the end. And so please, by all means, write down your questions as I'm talking so you don't forget them, because I would love to be able to answer those at the end as best as I possibly can. Okay, so let's begin, because as I said, this is such a necessary conversation for us to have, for a couple of different reasons. One, for our own education, as we are in a society today that is heavily being indoctrinated by our medical system. And as we continue to insert ourselves in medical programs, et cetera, just to be able to have the knowledge. This is also really good for patients that at some point through you all's careers and my own that will serve, but also for the communities that we are actively living in and serving, just to be awakened and then being brought to information. So I really want to start off this chat today diving into racial science, so to speak. I want us to be able to divulge a little bit of the history of racism when it comes to medicine, particularly. As I said, we won't be able to go through everything today, but when it comes to medicine, and particularly one of the people who we can point to is Thomas Jefferson. And the reason for that is because he essentially was a part of the scientific evolution that race formed out of. And so this was in the time of the expansion of the slave trade. This was also at a time where he essentially founded the framework of race. And so one of the things that I want for you all to know from the very beginning, and if you have not done this yet, I would love for you to Google race, the definition of race. And when you look at the definition, nothing comes up of a particular class or color, right? When you look up the definition of race. And so what that lets me know, and I'm hoping that it lets you know from the very beginning, that racism did not come from race. It was actually completely the other way around. Okay. And so I want us to be able to have a conversation about anti-racism and then also health equity here. And so when we think of somebody as such as Thomas Jefferson, who invented the framework and then also justified slavery for indigenous people as well as Black people, this was really in the height of as he was creating what we know as the new nation. And so if you think about the new nation, it's interesting because it was particularly founded upon freedoms, upon liberties, upon inequalities. However, there is this marginalized portion of racism that heavily is still in play. And it completely removes those who are Indigenous and also people of color and Blacks from excluding them from those freedoms, those liberties, and the inequalities. And so I want us to talk about the racist system that has been made up to essentially categorize and govern people. And so when we think about race, it was literally designed politically to help people understand where they were in class, in status, and a lot of it in profitability. And so when you think about Blacks and Indigenous people who were enslaved, it was always by those who were their white counterparts, who essentially put them in a predicament of being dominated by, right? Dominated by their white counterparts for their labor, for their torturous experiments, to further science. And we'll talk about a lot of that here today. And so when we think about the construct of racism that is heavily still utilized today in our system, we see that in laws such as the Jim Crow laws. We see that in legal definitions at times. We can even see those in court decisions as well as extra legal terror. And so one of the things that I want for you all to understand when it comes to Thomas Jefferson, his philosophy was that he considered a woman who brings a child every 2 years as more profitable than any man on the farm. Okay. And so when we think about that, we think about slavery being used once again for profit and for class. Now, I want for you all to have this particular image here imprinted into your mind as we move on to talk about how in the US, doctors essentially legitimized the slave system for those who were slave owners. And one of the people we can really pinpoint and talk about here is Samuel Cartwright. He was a prominent doctor within that time who allowed for the system of slavery to be legitimized by his practice and studies. Something that he often said was that he considered that the racial concept Blacks or Indigenous people had different diseases than whites, right? He is the person who we can pinpoint to the thought process that Blacks had a different lung capacity than any other race. And because they had a different lung capacity, it made them more susceptible to slavery and to be put into slavery, essentially because they needed the covering of a master. They needed to be looked after, right? Something else that we also notice when it comes to his particular practice is that he believed that slaves were only healthy. They were only good when they were underneath a master to be able to be watched. So typically in this time of slavery, a lot of what happened was slave masters would take their slaves to prominent doctors to get it completely written off that the slave was in good condition, whether that was to be sold or to be kept for their status gain. Okay. And so he is also a doctor who came up with the name for slaves running away from plantations. He, in his mind, considered it to be a disease versus them understanding that the torture that they bared was way too heavy and were trying to escape. He took it as a disease, which further allowed for slaves to continue to be enslaved. And so when you think about even when slavery started to end, it was his ideas that Black had a lower lung capacity, that essentially stuck with the slave masters, that continued on some slaves being brought to freedom, but a lot of them being kept in captivity. So the scientists' belief that was that Black bodies were very different. Their bodily genetic makeup was very different. And it gave way for unethical experimental practices on Black bodies. And so I wanted us to be able to note this before we really dive in to talk about gynecology and obstetrics, because the thought process that these laws could be created, or these essentially thought processes, these philosophies that could be created around Black bodies, completely went right into the science of what we now believe and what we now take place into the medical system. So this here is just an example. This was an example study done on a woman who had come into the medical system, came into the hospital, who had been complaining about pain. And they essentially did her panel of blood work. And so one of the things that we see here on this particular diagram is that the GFR is stated in two different areas, one for non-African Americans and then next for African Americans. So what this lets us know is that in our medical system today, when a person of color walks into the hospital and they are complaining of pain or continue to go about getting treated, there is a specific design for treating them. It is classified for discovering what particular diseases that they may have that no other race is thought to be able to have based off of Cartwright. And so I want us to take note of this, because as you go through the process of your understanding of the medical system that is at play when it comes to racism in gynecology and obstetrics, we have to note that from the very beginning, when someone walks in who is a person of color, they are immediately, the thought process is, what type of genetic disease do they have, not based off of their blood panel, but based off of their race. And then we have to ask each other again, what is race, right? Because when we initially looked it up, it had nothing to do with the color of someone's skin. Okay. And so that brings us right into Mr. Sims. Not my favorite person. It brings us right into Marion Sims. And it's interesting because you will hear about his name, and when he is typically spoken of, he's spoken of as the father of modern gynecology, right? He is the person who has been complimented and heavily rewarded for his brilliant achievements when it comes to creating and inventing the speculum, also for what we now know as the cesarean, and several other experiments. However, he did these experiments on slaves. These experiments were torturously done on slaves and Black bodies in order for him to introduce what he tried to move forward as far as the medical needle. And so I really want us to be able to talk about a little bit of background about Sims and who he practiced on and the extent of which he practiced on. And so when you think about the effects of these experimental surgeries, he was conducting these on his slaves, right? And those that were within his community. And so when you look at this picture here, the beautiful woman on the table, name is Arnica. And I want to be sure to give her a name, because when you look it up, it's just classified as slave women, but is never particularly she's literally not seen as a person, right? And so Arnica in this particular scenario was being observed by Sims. And this was after heavily receiving his medical experiments. Arnica particularly had gone through 30 different surgeries and more with Sims, along with 11 other slaves that are unfortunately unknown. And so once again, he was the first to create the speculum. But when you look at his particular practice, here's an image of Arnica laying on the table, and him as well as his colleagues getting ready to conduct a study. And I put into the left-hand corner a write-up, and it is an article called The Black Necros Experiment. I put in here an article where he had specifically said, I poured boiling water on the legs of a Negro. Okay. He conducted his experiments without any anesthesia, repetitively. And so there had come a point where his colleagues no longer wanted to take place in the torturous experiments of these slaves. And so he therefore had other slaves come in and harness and hold the slave that he continued to do these experiments on down. So they four became his colleagues, but never receiving any recognition on any of his experimental studies. And so when we think about the medical evolution and moving, when we think about moving medicine forward, when it comes to anesthesia, it was something that came up in the 1940s. However, he continued to experiment without it because his philosophy, which has now been carried in medical textbooks, was that Blacks did not experience pain. They could endure, right? They did not experience pain like their white counterparts. And that was due to slavery, right? If you think about slavery and you think about the chastising and you think about the beatings that slaves endured and then were placed right back into laborious positions, such as Arnica, Arnica would go through a gynecological experiment with Sims without any type of anesthesia. And then she would get up and continue to perform slavery duties, bleeding, okay? Bleeding through her pelvis, bleeding through the cesarean experiments that he practiced until he felt he got it right. And those of you who I don't know who are so versed into a surgical experiment, every single time the womb closes, it continues to create scar tissue. So you have to think about that being medically receiving a procedure 30 plus times. Okay. And so his mindset was Blacks don't experience pain. And now we can see how that has carried over into disparities today. One of the things that we often hear when we think about gynecological births and we think about infant immortality is that Blacks go in complaining of pain, right? They're complaining that something doesn't feel right. But they, on a scale to 1 to 10, if they said their pain level was 10, the mindset of, unfortunately, the medical staff is, well, a 10 could not be that severe for you, right? And so one of the things that I feel like is necessary to note is that there have been medical books recently literally as early as 2020 that have been recalled, nursing books that have been recalled, because within the nursing books, there are statements such as that discredit pain levels for Black women, that discredit pain levels for those of color, who are also brown and indigenous. And so if we think about our medical field who has been ingrained and indoctrinated to step into practice underneath the philosophy, of Sims and Cartwright and other medical professionals, it would allow for us to be triggered to really understand how adequately are those of color being served in practice, in medical practices, right? And so one of the things that we'll hear often, and unfortunately is not something that I enjoy repeating, but it's necessary for this particular segment that we're talking about, is that there are studies as of date that have let us know that women, Black women particularly, are 3 to 5 times more likely to die during childbirth and labor than our white counterparts. Okay. A lot of that has brought about the study of what we now know as maternal immortality. So when we're thinking about this here and we see 43.5 compared to 12.7, it should jog us to realize that there is something incorrect about our medical system and how it is practicing efficiently with those of color, correct? Okay. And so what I really want to talk about is where we can start to bridge the gap. Where is it that we can start to understand how to better serve our communities, how to better serve those who come into the medical field seeking attention and service, and also how we can advocate for them at such a greater capacity than what has been displayed throughout history. And so I'm going to tailor back to my notes here. A couple of things that have occurred that I want for you all to dive into after this call is to look at how Cartwright and Sims and the evolution of the framework that they created started what we know as a lot of the history of Planned Parenthood. I want for you all to also know what it sounds like and what it looks like for the statistics around birth control. Okay. If you all have never heard of the, give me a second because I want to make sure to pronounce it right and it's on the tip of my tongue. The Tuskegee Experiment, okay, about the Mississippi Ambidectomy experiment. This was when a lot of women, shortly after Sims, went into a medical institution seeking help for their womb and were given hysterectomies involuntarily. They were told that they were going into surgery to fix whatever the issue was and were given a hysterectomy unnecessarily and also without any permission. These are things that we have to start to develop and look at because they are the history of, unfortunately, gynecology. Okay. Something else when it comes to birth control, as I mentioned earlier, I specifically want for you all to look at Norplant. Norplant was a specific birth control that was offered and it was essentially promoted the most by David Duke. His philosophy, which is interesting because David Duke was also previously a part of the KKK. His philosophy was that Black women were bearing children so heavily that they needed to figure out how to be able to shorten the lifespan and also to essentially castrate women. Okay, so his thought process was let's introduce birth control. And the birth control was specifically Norplant, which on its own has a repetitive history for causing women infertility. What we now know as the word infertility. Okay. And so a couple of questions that I have for you all when it comes to how we can bridge the gap is, what is race? Right? I think the first step is to be able to demystify what is race. Because when we look at our history, there are so many inconsistencies in the definition, right? We have to understand that it was racism that caused the categorizing of race, but the term race alone did not. Okay. The other is, how do we identify statistically, right? Statistically and scientifically what Black race even is. Because if we pulled someone's panel and we took their blood, we would only know the consistencies within their blood, but not what race they were. Okay. Another thing that I would love to ask you all when we think about what we can do is bridge the gap is, wouldn't it be more useful to conduct a study around the factors of a community, right? The factors of a community versus the factors of a particular person who walks into a medical institution seeking help. And so the factors of the community would be, what type of grocery stores are near, right? There is no coincidence that there are very extremely few McDonald's, so to speak, in a suburbs community than there are in a poorer community where they're on every corner, literally every corner, right? Would it be more useful to conduct a study around stress levels due to economics? Okay. Another thing that I would like to present when it comes to bridging the gap is, how could those within the community serve the community better when it comes to potentially other wellness professionals? And so while I know that gynecology and obstetrics is very heavily placed into our mindset as the first nature of care, midwifery is actually the first nature of wound care for a woman. Okay. Your local midwives can also conduct gynecological pap smears. Right. The local midwives are so ingrained in the community and understand how the community function that they can spend more time with a patient, which therefore lowers the maternal rate and disparities. Doulas can also do this as well when presented into these particular institutions. So one of the ways that we have actively, myself as well as colleagues of mine, have actively been pursuing to bridge the gap here when it comes to maternal mortality has been getting doulas to be underneath the coverage of insurance, right? And you all will see January 1st that the military is actually going to be the very first passing law where they will cover doulas underneath TRICARE. And this was something that was extremely important to me in particularly because I am also a military wife. And so one of the things that I noticed when I became a military wife was that there were so many women who were on base and their husbands would therefore be deployed, etc. And they would be left alone throughout their care They wouldn't know which questions to ask. They didn't know fully what their coverage even offered. And they needed someone to be closer to them that would not only hear them, but also advocate for them. And this is the same for every woman who is pregnant. And so I'm so excited about the TRICARE law being passed come January 1st, because it will show us how much statistically infant mortality rates become lower. And I'm hoping that that is just the first step, and that will trickle into every other insurance company thereafter. Okay, so one of the things that I want to note with you all who are biomedical researchers is to start to dive into what this looks like in your own community, what this looks like in your educational practice, and how Black race, independent of every other factor, increases the risk of extreme preterm birth and its frequency occurrence, and how you all, with the tools that you've been supplied throughout your program with Sarah, can start to advocate for women in this way. Okay. And so I want to be able to give you all 3 resources. And I believe that these 3 are just phenomenally written. They really dive into the beginning of what race and racism in obstetrics started to look like. And it also gives you the history of what true slavery that we are not taught within our school programs actually presented itself as. And so Sarah will also have these to give you all via email, this particular slide. But if you want to take a moment to write down the titles of these books, I highly suggest it. Okay. And then the last thing that I want to leave you all with is a video. And this video is one that has been extremely near and dear to my heart, about a particular couple who had gone into the hospital seeking assistance for their birth, where she delivered her baby and was essentially left for dead. And what I mean by that is she had been complaining of pain after having her baby. The nurses as well as doctor ignored her pain levels. She needed a CT scan that they did not give her until several hours after she had given birth and had asked for one, and unfortunately passed in the hospital after giving birth. This gentleman, her husband, has gone on to start an amazing foundation organization to advocate for women in their birth process that I feel is key for you all to note. So I'll show you that now. So I would love to be able to open it up for questions that you all may have. It does make sense. So it sounds like what you've been, what it sounds like is there has been indoctrination of Cartwright there. And so when we think about, so my question to you, actually, I want to ask you a question. Can particular races be prone to certain diseases, or can a human being be prone to certain diseases? Because that would then, because it would almost be like you asking me, can only Black people or those of color receive cancer? And we have all known someone who has experienced cancer that is not particularly due to race, right? Right. So your question is so good because it allows for us to start to understand how deep rooted in our medical system it is classified due to racism, not race, right? And so I'll give you all an example, which is so interesting because I think also being in this field, I heavily noted. I had gone, today is Monday, so on Friday, I had gone to my optometrist. I like to get my eyes checked every year. Thankful that I'm able to do such a thing. And so I had gone in for my annual appointment because I had been noticing I'd been straining, and unfortunately we've all been on Zoom way more than we cared to be over the last several years. And so in my mind, I was thinking I have been sitting on a screen and a computer so much longer than I have ever in my life. So let's go get my eyes checked. And when I had sat in the seat, the first thing he had asked me is, do you have a history of high blood pressure? Right. The next thing he asked me was, have you ever experienced autoimmune disease? Right. It was not a question of what brings you in today. Right. How do you feel like your eyes are? He immediately categorized me to then see if he could connect whatever the test was going to tell him, because he had not yet done any testing. Okay. So when I asked him, so my answers to those questions were no. When I asked him, have you ever experienced, let me ask you a question. Have you ever experienced skin cancer? Have you ever experienced, right? And so he then begged to ask me, what is it that you do? So when I had told them I was a wellness professional and a student midwife, it was almost kind of like the alert had gone off. You all, I left that office and my vision was 20/20. Okay. And so it begs me to think, when we are approached with the thought process that a particular race may have a certain disease, do we see the disease before we see the person? Right? Do we see the disease before we even know, if like we allow for our brains to actually problem solve what they are stating versus what is happening? I wanted to be able to present that and give you an example, because I'm hoping that we've had this conversation, that when you step into your career field, that you always look for what the person presents to you before what a medical diagnosis from a book that has been rooted in racism tells you to do. Okay. Next question.
There's a couple hands, and there is a question that was up in the chat first, which is my favorite question for you, Sonia. It says, what was your career progression like? How did you get into this field?
Oh my goodness. So I am a younger sister, and my older sister is about 11 years older than me. So when my mother, which is really interesting, when my mother had my sister, she was like a one and done mom. She thought she was a one and done mom. And then 11 years later, I came. What I did not know up until that point was that my mother had always had heavy womb issues. She had always had a very low immune system. And I'm so happy that you asked this question, because of the questions that were brought up for me growing up. My mother had always had a very low immune system, is what we were told, susceptible to quite a bit. And so with my older sister, her senior year of high school, she got married and became pregnant. And I got to go through her entire birth process. I mean, all of her appointments. I was in the office asking her doctor 115 questions, to the point where he just gave me his medical book one day and was like, I think this will answer your questions more than I may be able to. And so what he didn't realize was that really started to basically kind of enlighten me to this world of medicine. And because that was my first and only introduction to the medical field, I had this stamp in my mind that I was always going to become an OBGYN. Right. So as I grew up and as our family continued to grow, I started to notice that my mother became sickly. And so my mother has always been a very, very fit person. I'm talking about from the time from in her womb, she was running at least 2 miles, right? My mother has always been a runner. From the time that I can remember as a child, she would wake up in the morning, she would go run, she would come back to the house and prepare us breakfast, and then we would all go off to school and work. And so I'd always only known my mom as someone who was extremely fit. With that being said, she started to go on her runs and come back winded. And I was extremely confused, but as a child, I'm observant. And then I'm also a child who's a little bit more clued into the medical field than the probably average 13-year-old. She started to come home and she would be extremely winded. And I started to notice this discoloration in her skin on her face happening. She would also brush her hair, and I would notice that she would shed a lot more than normal. So I started to ask her questions about it to see if she recognized it. There were a couple of series of things that had happened. She was complaining about her menstrual cycle at the time, to the point where instead of being taken through a process of any type of holistic treatment or resolve, the first thing that they offered her was a hysterectomy. My mother took the hysterectomy because in her mind, I initially was only going to have one child and I don't have any desire to bear more children, but she was never educated on what that can do to a woman's hormones after you've taken her reproductive organs, because they're there for a reason, right? All she knew was, if you take my hysterectomy, I will therefore no longer have a menstrual cycle, which therefore will alleviate the pain that I have to feel every single month. My mom at the time had been going through a pack of 48 pads within one menstrual cycle. That's a lot, right? And so when she went through her hysterectomy, I still have the picture. I like Google over this picture, which is how I know I was going to be in this field. The picture of the doctor taking out her uterus weighed 11 pounds because they were cysts of fibroids in her uterus. Okay. When they took her uterus, she was in the hospital for an additional 10 days. It was supposed to be an outpatient surgery. She had lost so much blood, they had to give her a blood transfusion. 2 years later, she developed lupus. I cannot prove where lupus came from, but I think you all catch my drift. There have been a lot of connecting the dots over the years that I had done. So my journey here really started from my sister and my mother. My sister going through her birth process, and then my mother going through her hysterectomy and not being educated about her womb at all. So I had proceeded to go pre-med, got into the school of my dreams in Northern California, was sitting in orientation, and the presenter who welcomed us to the program rattled off a quote from Marion Sims. And it was in that moment where I had awoken to a lot of the racist practice in our particular industry. And I felt very conflicted going through the medical program, having a lot of the information and the understanding that I was becoming aware of. So I took the holistic route. I left that pre-med program and I went on to study holistic nutrition, herbalism, I was a massage therapist, have held a massage therapist license for 17 years now. And that gave me a huge understanding of the anatomy of the body and how we are one whole person and we're intricately connected. And it has now led me to being a doula and a student midwife. So long answer short, but there were so many things that got me there. So there are a couple of things that I want to tell back now that I have the understanding of my family's history and the understanding of holistic practices. During that time when my mother had the hysterectomy, before she had the hysterectomy and was diagnosed with fibroids, no one asked her what her nutrition was. Fibroids are just not something that Black women get, even though that is something that is heavily a statistic in our community. It's based off of nutrition because nutrition can also heal fibroids, right? So we then have to go through what is the family genetics of how you eat versus, okay, you're Black and you obviously are susceptible to fibroids, right? So it gave me some ideas of starting to counteract what they had been told of what was going on. When my mother was diagnosed with lupus, we went back and forth to Stanford Medical Center for several years of her being the guinea pig at the time, trying to figure it out because lupus was not very well known. The only thing that they knew were her blood cells were attacking each other. I happened to be up late one night watching infomercials because I'm a geek like that. Watching infomercials, and it was a holistic nutritionist, and she had brought up how foods cause inflammation. And as she was bringing up symptoms, one of the things that she listed was lupus in that infomercial. And I remember screaming at 2:00 in the morning, "Mom, it's lupus, it's lupus. This is what you have." Because we spent 3 years of Stanford not being able to place a name on it, right? This is what you have. We ended up going to that medical professional, and she was who diagnosed my mom. She completely changed the way that my mom ate, and her lupus went under remission. In the medical care program, they gave my mom 3 weeks to live. It has now been 15 years later. Right? So all of these things cause my progression within this field of educating and teaching women about their wombs, because when we can do that, you're not only nurturing yourself, but the generations that come after you. That was an excellent question. That is correct. Because we have to think about it. If you are, especially now that we all are becoming so very awakened to non-toxic living, I hope we're becoming so awakened to non-toxic living. I want you to think about what your family used to clean the house with, right? And so it's historic in a Black family that unfortunately we cleaned with bleach. What type of chemicals are in bleach? Imagine those consistently getting onto your skin, right? And so there's so many other, especially when it comes to environmental factors, that we have to take note of, which is why I feel like a study across the board of a community does so much better than solely race, because what is race?
I also want to add, I put something in the chat for the class. Dr. Claire Perry has famously addressed the question, is it race or is it racism, and how important asking that question is. So she's great.
You're so welcome. You're so welcome. And that's so good, because you also have to think, which is why I typically, and I feel like this across the board happens with a lot of holistic wellness professionals. Anytime an ailment is brought to us, we always go back to nutrition and diet. And I know that that is not something that is popular within the medical field. And it's one of the things that I've recently have been questioning. Why is it that it is not a requirement for doctors to go through a nutrition course before they become licensed? Imagine, like, So this is also another reason why I pulled back from obstetrics. My particular obstetrics program was because it wasn't until I was in it did I realize that I wasn't signing up to be a doctor to help people. I was signing up to become a surgeon. Right? They teach you how to be a surgeon, not how to nurture nutrition. And so you'll constantly find, especially as you mentioned, when it comes to different classes, different groups, different marginalized groups of people, we always have to go back to nutrition, but then we have to think about how much politically our nutrition system has changed over the years. And that's a whole other can of worms and class discussion and conversation about how deep rooted the government is into our nutrition system and what they fund and what they don't particularly.
Yeah. Well, thank you so much, Sonia, for everything.
You're so welcome.
With that, we will end the recording here, and I will see everyone on Wednesday, but I hope that you have a great rest of your week, Sonia. And if everyone can kind of like clap so Sonia can see some hands, it's hard to do over Zoom.
I appreciate you so much for allowing me to teach this segment on your class. Thank you.